Good afternoon. Sorry I'm a bit late. I was coming back from a teaching and trying to get Teams running, so sorry about that.
It's okay.
Yeah, it's live now.
Thank you. Good afternoon and welcome to the Health Overview Scrutiny Panel. I'm Councillor Ian Holder, Chair of the Health Overview Scrutiny Panel. Members of the public are invited to view this meeting online. Those present are requested to keep their microphones on mute and only to turn them on when you are called to speak. Members are requested to keep your cameras turned on at all times. Officers and external presenters are requested to turn your cameras on only when you are presenting your reports or answering questions. If you'd like to speak, please write your name and RTS request to speak in the chat function. I'd now like to invite those present to introduce themselves. Councillor Richardson.
Good afternoon, I'm Councillor Julie Richardson from West Hayling, Havant Borough.
Thank you. Councillor Heaney.
Good afternoon. I'm Councillor Graham Heaney. I'm a Labour Councillor for St Jude Ward in Portsmouth.
Thank you. Councillor Atkins.
Hello, I'm Councillor Matt Atkins. I'm a Councillor for Cotton Ward in Portsmouth.
Thank you. And Councillor Agate.
Good afternoon. I'm Arthur Agate, East Hants District Council.
Thank you. Firstly, apologies so far. We've received apologies from Councillor Anne Briggs and Councillor Joanne Burton. And we've also received apologies from Councillor Martin Pepper. And we've also received apologies from Tracy Redmond from South Central Ambulance Service. And she can't make it due to operational pressures. So agenda item 4 won't happen and everything else will be brought forward. Number 2, declarations of members' interest. Do any members have any interest to declare? No. Thank you. Minutes of the previous meetings. I wasn't here, but do we have a proposer and seconder for the minutes? We approve the minutes.
Should I propose them as I was chairing?
That's a good idea. Anyone to second that? I think Councillor Agate is happy with that. Right. I've had a request for urgent business. I think all of you received a report about the North Harbour practice closing, and I think Joe's going to give, if you could give us a bit of information about that. And I know Councillor Atkins has got some questions. Over to you, Joe. Thank you.
Yeah, of course. My name's Jo York. I'm Managing Director for Portsmouth within Hampshire and the Isle of Wight ICB, and I also have a joint role with Portsmouth City Council. So we unfortunately have received formal notice on their contract from the partners at the North Harbour Medical Group based in Cosham, that they've given us formal notice on the contract to the Hampshire and Isle of Wight Board that they can no longer provide care and are in effect returning the contract. So the practice have a 6-month notice period. However, we recognise that this is a very difficult position for them, and they have some real some operational challenges and some workforce challenges across the board, which means it will be quite difficult for them, I think, to maintain operations for the 6 months. So we are therefore working with them and other local practices to achieve a managed patient transfer. So we will transfer patients to a different practice within the city. We do this through what we call a managed list dispersal. It's postcode based. And what that means is that we will write out to all the patients in the who are registered with the practice in early January, identifying which practices fall within which practices have the boundary within their postcode, and based on that postcode, patients will then be asked to identify a preference for which alternative practice they can move to, and we will manage that process for them through February into March. We are working very closely with other local practices in the area, particularly in the north of the city, to make sure that they have that they're able to recruit additional staff and put additional resource in and to provide additional capacity for those additional patients. We had been working with North Harbour to see if there was an alternative, because obviously closing a practice is not really where any of us want to be, and we were exploring mergers with another practice, but unfortunately those didn't come to fruition, and we don't really feel there is another alternative other than this managed transfer, which we will write. So we've written to all the patients. They will hopefully have received those letters by today. Obviously, with the postal strike, we can't guarantee that everyone would have got the letter on the same day, which is what normally happened. The letter actually went on Monday. We hope they've all arrived by today. We've put something on the website. We're asking the patients not to do anything suddenly. They don't need to re-register with another practice. We will manage that process for them, and there will be patient engagement events early in January to support them through that process. I'm sure you've got lots of questions, so happy to take those.
Thank you, Jo. Councillor Heaney, you've got your hand up.
Oh, sorry, I thought Councillor Atkins had indicated first. I mean, I'm happy to go if he wants to go first, since it is in his ward. I don't mind. Well, I'll kick off then. Okay. How many patients are affected by this?
It's just over 9,000. Well, 9,000, just over 9,000 patients are on the list.
And are they predominantly?
The majority live in the Caution, sort of north of the city.
North of the city, right? Okay.
Yeah.
Are you able to share the reasons why the practice is not able to continue for at least a 6-month notice period? I mean, I saw the letter. I did read it very quickly, but I haven't been able to. Obviously, I'm waiting for the meeting. Yeah. What's happening here?
So they one partner has given notice, and they will serve the 6-month notice period. Another partner is on long-term sick. They've also had some challenges and a number of staff vacancies in both their operational management team and their nursing team. So whilst we are working with them to put interim arrangements in place, we are concerned that the longer we leave that, the more destabilised they become. So we feel it's better for everybody to, and we've worked with other local practices to move the patients sooner rather than later to enable that safe transfer and to enable them. If we left it for the full 6 months, I think all of our concern is that it will be harder for them to keep the staff and therefore to operate safely. So that's why we feel we need to do the move sooner.
Yes, and you said 9,000 people or 9,000 patients are registered there. The idea will be to disperse them to other practices, but as you quite rightly pointed out, those other practices are probably already under their own pressures in dealing with patients, and presumably until patients have responded, we won't know exactly where people wish to go. So therefore, the provision of extra support is going to follow on once people have registered. So there's going to be a bit of a time lag, isn't there? Plus, also, if the current practice is closing because it can't get staff, are we going to face difficulties in supporting the existing practices to deal with these patients? It doesn't seem a particularly ideal situation. They'll have more patients to deal with. They won't have recruited the staff. They're under pressure. It's looking like, piling worse on worse, potentially, at least in the short term.
It's definitely not an ideal situation. It's not a situation any of us would wish to be in, and it's a very, very difficult decision for any practice to make to give notice on the contract. We are working with the local practices to see how many they can take. We think across the practices we can accommodate all of the patients, and we are working with them already on the basis of how they might staff up, so that they are looking and actively recruiting at the moment. Certainly the local, the 2 nearest practices. As I say, patients will be asked to give a preference a first, second and third choice, and we will do everything we can to accommodate them. But obviously we need to make sure that demand matches the capacity, so that we can accommodate everybody safely. So we may not be able to give everybody their first choice, but we will be explaining that to them, and we will be providing patients with information about the other practices, and we also will make sure that those people that are perhaps with a chronic disease or an end of life register or other sort of more vulnerable special conditions we put additional support around those through the transfer to make sure that things like medication reviews or end of life packages don't get missed, etc. So we look at supporting that in a different way as well.
Yeah, are you confident that we can make the relevant transitions within the 3-month period, so that when that practice closes, it will actually be relatively smooth and most of the issues will have been sorted, or are we likely to see some further issues after that period? I just want to get a sense. I mean, maybe a difficult question to answer, but a sense of how the transition. You explained a bit of the detail about all the stuff around the bureaucracy of paperwork and so that needs to be transferred. Make sure people are getting their medication, their histories sort of go over and so yeah.
So that transfer process is a smooth process. It's operated by the CSU, the Commissioning Support Unit. It's an automatic process. It's based on individual patients' postcode. They will do all of that work. The transfer of the medical records also happens electronically and is a fairly automated process, and that's by the GP information system. So all of our GPs in the city run a single system operated by a company called TPP, and it's System 1. So we've been working with both the CSU and TPP to make sure that those timeframes align and they can deliver within that time frame. They've given us as much assurance as they can that they can do that. In terms of the actual transfer of lists will be I'm as confident as I can be that will be a smooth process and patients won't need to do anything, and we've had to do that previously, so we've got a very detailed project plan that will enable that to happen. The risk, of course, is the capacity at other practices and the pressure that all of our GP practices are under in the city, so that we recognise is going to impact on patients from North Harbour practice, but also other local practices as well. So we're doing everything we can, working with those practices to look at how do they create that additional capacity, how can we attract additional workforce into the city. The two practices are
Sorry.
I was going to say the nearer practices are fairly big and robust practices, so they are perhaps in a better position than some others to do some of that recruitment, and we're being very, very careful to make sure that we don't put additional risk on practices that are already struggling.
I recognise others want to ask questions, so I'll just finish with this final one, if I may.
I'm sure Councillor
a lot of work's been put into the GP Summit and discussions around trying to improve access and ability to get GP services. Is any of that producing any real results?
It is really difficult, isn't it? We've had the GP Summit. Some of the challenges are national, around the contract, around workforce, around a national shortage of GPs, and around training positions, and some perverse issues around the pensions, the NHS pension scheme, which means it's almost making it less attractive for older GPs to stay in the profession, which is crazy, and not things that can be easily resolved. More locally, what we're doing is we have put additional funding into all of the practices in the city through resilience bids and increasing access over the winter. We are continuing to work with them to look at how we can increase their capacity, how they can work together, how we can develop citywide services, looking at the sort of the communications campaign around that. It takes a team to care for a community. So helping public better understand that it's not just about going to see the GP. There are other roles. We've still got a huge amount of work to do with that. I was at a public meeting on Saturday, and real concerns around all of the practices and how people access and telephony. So we're going to do hopefully some work with Health Watch off the back of that, and we continue to work with all of our practices to resolve some of these issues. But there are some things I think we can do quickly to improve things, but I don't think there are many quick fixes. This is something we've got to work really hard over the next few months, and it's a national issue, and the pressure at the moment is really intense, really significant.
Okay, thank you, Joe. I'll let somebody else ask questions now. Thank you.
Thank you. And just briefly, Councillor Jeffrey, thanks for joining us. Have you got any interest to declare?
No, I don't know.
Thank you. Sorry, now Councillor Atkins.
Yeah, thanks for the
Thank you,
report,
Chairman.
Chairman.
No.
Could I just
Sorry. Did I?
It's
You
Councillor
did say
Atkins.
my name, didn't you?
No, Atkins.
Carry on.
Yeah, thank you. So you said that the surgery was unable to give 6 months' notice. At what point did the council become aware, did you become aware that the practice was closing down? Because obviously it must be quite recently, is it?
Yeah, it has. Yeah, so we've been working with them for a while, knowing that they were struggling and under pressure. We had hoped that we could put some interim support around that, and we were looking at other alternative solutions. However, they haven't been able to come to fruition. They gave us notice last week, formal notice last week. They were obviously very keen to tell their staff, rightly so, but we know that once the staff are aware, that often means it comes into the public domain, and we wanted to make sure that we gave the patients and did that public messaging in a planned way, rather than it sort of leak out and people hear by other routes. So that's why we've moved really quickly with the communications over the last week to brief councillors, brief other stakeholders, and get those patient letters out. And the information is on their website today, which means it's live. But as we say, we've hoped that all of the patients will have received the letter. There's an email address that they can contact us directly in the ICB, so that we will manage any concerns, and a telephone number. And as I say, we'll be holding patient engagement events in the new year.
I don't know that much about the internal workings of the practice. So you say they've got one partner who's decided to retire or move on or has given notice, and one who's long-term sick. Do they have how many partners does the surgery have?
They originally a 5-partner practice. So one partner had already given notice and had left. So they are down to 2 GPs, in their working. They have tried to recruit, but I think, that's proven really difficult. We know there are also real challenges around the building in the Cosham Health Centre. And I think, just the level of workforce challenges that they were facing just made them feel it was very difficult for them to continue.
Well, I mean, I quite understand it's a bit of a perfect storm if your building's a problem and you're down on GPs who run it, and then they lost administrative and management staff as well.
Yeah, and some nursing staff as well.
Is that recent as well, or has that been happening over?
Yeah, I think we know that turnover in all of our practices and the NHS at the moment is higher than perhaps it's been previously. So there's always been issues, but this is, it's all been quite sudden, quite recent, and does feel a bit of a perfect storm for them that has resulted in this, as I say, very difficult decision for them to take.
I mean, in terms of work, and I don't know if this is possible or not, what can be done to at least possibly try and retain, so if there's 2 working GPs and some nurses and some administrators who want to work in the Portsmouth area. What can at least be done to return? Are they being encouraged to apply to the other branches we're moving patients to? Is that likely to happen? Or are we likely to lose the entire capacity of the surgery?
So we are certainly having those active conversations, and we will facilitate those conversations for all of the staff, including the partners. They have to be mutually agreeable terms for the individuals involved, don't they, in the other practices. So but we will do what we can to facilitate and support those conversations. We think that given particularly some of the nursing and administrative challenges that other practices face in the city, that there is every likelihood to move those staff. Again, that's why we feel it's better then to make the transfer sooner rather than later to enable that to happen safely, and to manage that transition as best we can.
There isn't much we could have done or could do, is there? So there's two GPs that want to work and run a practice. There wasn't anything we could do because obviously they wanted to move to another building. There wasn't any administrative support, the council or any of the other partners in the healthcare system could offer to help them, look into starting a new one, or is that just too much of a large challenge? Because I know part of the problem is the location. Did we explore, helping them move to another location?
That I think has been part of the real challenge, and I think the building and the lack of alternatives in the north of the city makes that really difficult. We had been working with them and are working with them on a longer term alternative on the Highclere site that members may be aware of. But that's 2 years away, and there isn't really any alternative accommodation in that part of the city that we could easily move them into or support. I know what you're thinking, move and create a new practice. I have looked at that. That wasn't something we felt we could do within the 6 months, really. And some of the conversations we were having prior to that was around, could we merge? How would that work? But it just didn't come to fruition, unfortunately.
Is one of the ways that the council obviously would want to work with local commissioning and local GPs is, if we are aware of our access or are possibly working on building suitable sites for GPs, that's something we're making sure is integrated in our development and construction plans. Is that something going forward which is still happening? So at least we're creating spaces if we can find the GPs to fill them in the next few years, because if suitable locations is the problem, I feel like that's something the council should be working on urgently to help build capacity in.
Yeah, I think so. We are definitely looking at that with the council. We've got other sites in the south of the city that we're having those active discussions on. As I said, we're looking at Highclere, and the Highclere capital had been approved. Given the cost of living standards, there is, we are having to go back around that, really, because of that's with NHS England. I think we all know that the Cosham property, premises position has been really difficult, really challenging for a number of years. And there is longer term plan within the estate. So I think whilst we would want to continue with the Highclere site because it's, we've got the planning permission, we've hopefully can get all of that sorted. This does give an opportunity, I guess, to look at it again if that doesn't become the best option, and then we would look with the council. But at the moment, we're trying to pursue the Highclere site as the longer term alternative.
Because obviously we have these sites that we were hoping to help them move into, including and these development plans for Caution. Is it a case of we should carry on, and if we build it, they will come kind of thing, or is this a real blow to actually being able to keep practices going in Caution? What chance do we have getting new ones or very substantial expansion in the existing ones?
So So I mean, obviously we still have Caution Park House and Wootton Street. We have the Drayton surgery as well, a bit further out in Farlington. We do, as I say, we do think the Highclere site is still needed, absolutely. So we absolutely do think we need additional premises. We haven't got an alternative that will do that quickly within the next 6 months to minimise this risk. But yeah, in the future, we would expect we need to look at the estate in Cosham as well, and we'll need the Highclere site, or if for any reason that can't go through, an alternative premises.
Yeah. With the I just wanted to, I'm sure you had, but I just wanted to explore that we'd tried every option for saving the practice. But with the dispersal and transfer of patients to other surgeries, will that be just within the Portsmouth boundaries, or are there surgeries over into the Fareham area? You know,
There are a few more practices in, patients, I do apologise, who are out of city. So we will be working closely with practices in the other area to understand how that will move. But the vast majority, are in the city.
Yeah. I mean, you kind of already said you're hoping to be able to accommodate them all in the existing practices, but you know, I have been hearing that informally and through some form of chats that they are really very, very close to capacity, some of these surgeries, and struggling. What will happen if we can't accommodate all of the patients from the surgery into those existing practices?
So we will accommodate all of the patients into another practice, and the conversations that we have had with practices in the local area is absolutely that between them they can accommodate all of those patients. So we would ensure that each patient is registered with a new practice. So please don't get me wrong, that it will not be a case that some patients will not have a GP practice to register. Everyone will have a GP practice to register. Everyone will be registered with an alternative practice. I really apologise if I didn't make that clear. I think that what the point I was trying to make is we know there are capacity challenges, so we need to make sure that this just doesn't make the access issues worse, and that's the work we're doing with the practices to make sure that they can safely accommodate them and it doesn't destabilise anyone.
Yeah, so obviously, famously, Portsmouth is already one of the cities with the lowest number of GPs per population. Was that pressure any less in the north, or was it sort of evenly distributed across the city? And are we getting near the point where, you know, there isn't anything we can do to almost say, well, this is a bit of an emergency in terms of GP recruitment, and what government support can we ask for to really try and address this, because it's getting pretty critical, I'd have thought, in Portsmouth, given we were already in one of the worst positions, and it looks like things might be going worse rather than better at the moment.
Yeah, so it certainly is a very challenging position. We continue to work with all of our practices and Portsmouth Primary Care Alliance and with other partners in the health system to look at how we can manage this situation and improve recruitment. Some practices are managing to recruit, and we've been working with the PPCA to take on additional new doctors coming out of the training scheme. We've struggled with that. It hasn't been as successful as we'd hoped when we set that scheme up in September. Again, there is a national shortage of GPs, and the challenge that we've got is some of the newer GPs coming out are finding locuming a more attractive alternative. So we're working really hard again with everybody to look at that. As part of Hampshire and the Isle of, this isn't just a Portsmouth City problem, it's across the board. And again, we're working across Hampshire and the Isle of Wight to look at, are there more solutions we can do at scale? What's the care model? How do we respond to the Fuller report, which was a national report recently that looked at more integrated models of care? We're really well placed for that in the city, and we're continuing to explore those options with our community trust provider and with other partners as well, and adult social care and the voluntary sector. So all of that work is ongoing. You're right. I think we do need to absolutely prioritise that above all else, and we have restructured our local ICB team to do that, and to have really, those conversations with practices, which we do regularly, but to really spend some time around how do we manage this going forward? What's our sort of more strategic plan locally? So we're having those conversations as well. The challenge we've got in doing that is the demand pressures at the moment make that really difficult, and particularly with the recent increases in demand around strep A, that's been even more challenging. But we are definitely doing that, and working with all partners, including the council, to support that.
Thank you. I mean, some of it is disappointing news, but thank you for the hard work that you're doing. One last question. In terms of sort of notifying and explaining this to residents, did you say you would be organising some sort of resident engagement meetings in January?
Yeah.
So,
yeah.
do you have dates for those yet or not yet? Obviously, I think I'm local council.
Not yet. We will get those. I suspect we'll try and get those out next week, and we'll get them. I'm expecting them to be probably the first or second week in January, as soon as we can, to get those in the diary. And they'll be for patients registered at North Harbour, but also probably other patients registered in the other local practices, because we know that they will have some concerns as well. So yeah, and they'll be advertised through the practices.
Okay.
For those patients, but of course, Councillor Atkins, we will provide you with an invite. I'm really happy to have a meeting and meet with you around it and give you a more detailed briefing. And we're doing similar with the MP for the area and
I think we'll be the same meeting. I'll attend the one with the MP.
Oh, okay, cool.
We can do it all in one meeting. But thank you very much.
Okay, thank you.
Thank you. Councillor Agate, you had your hand up earlier. Do you still want to ask a question?
I need to have another look at that. There are patients with special care needs or certain special needs, and within that particular group, nurses who are skilled in those particular needs. Will you be directing them towards the new surgeries that these people are going to be referred to? In other words, if you're directing patients with special needs to other directories, there are nurses there who obviously have these skills and
Absolutely.
are going to be made redundant. Are you directing them towards where their patient is going to be?
Oh, I see. Sorry. Yes. Sorry, I didn't quite understand the question at first. Yeah. So obviously, as I said, we will do our best to work with all the practices to try and accommodate the North Harbour staff and retain them in the city. But obviously, that's got to be a conversation between the new practice as an employer and the individuals as employees, and make sure that that's a mutually beneficial agreement that people can reach. But I would suspect, yes, certainly in the case of the nurses, that there would be some of that. But all of our practices are well equipped and have really good nursing teams, so they can accommodate those special needs. What we'll do is provide additional support to make sure that we've flagged and identified those patients that need that special support, or that additional support rather.
Sorry, it was just a thought that obviously they were getting additional patients, therefore the staff are going to get a little bit thinner on the ground, and you have staff available that you could point in that direction. Hopefully, they'll come to some agreement. Thank you.
Absolutely. Thank you.
Thank you, Joe.
Thank you, Councillor Holder. I'll wait, shall I, and come back to do the other part at the end.
Thank you.
Okay, thank you.
As I think I mentioned earlier, item 4 on the agenda won't be taking place today. South Central Ambulance Service can't make it due to operational pressures. So we're going to move on to agenda item number 5, Portsmouth Hospitals University Trust. I think Mark Orchards is here. If you give us a brief update, if you anything to add to your briefing paper that came out.
Thank you. Yeah, Mark Orchard, Chief Financial Officer here at Portsmouth Hospitals. Obviously concerned to hear that last item, but thank you. Yeah, so as well as being Chief Financial Officer here at Portsmouth, I've also got portfolio responsibility for estate developments across Portsmouth hospitals. And listen, I know that you've been well briefed on this development over a number of years, actually. So I'm just going to briefly just introduce it. But actually, there's paper there that's hopefully self-explanatory. And then very happy to take any questions from anybody, of course. So everyone's well aware now. We've been promised a new emergency department for Portsmouth for many years. Secretary of State announced there's some funding, £58 million back in 2018. We've had to navigate three-stage national business case approval process, as well as everything around planning and so forth. And councillors on here have been really supportive there. And obviously we've got full planning permission on the final design. Just a few months ago, we got the final Treasury approval to release the money, which is brilliant. And as I'm sure everyone knows, we've now commenced the enabling works. So back in September, middle of September, we closed the East Staff car park to prepare for demolition works. The site clearance works are now complete. So if anybody's come to site recently, you won't see that car park anymore. It doesn't exist. It's been demolished, been recycled actually as well. It's but that's part of our green strategy as well, which is brilliant. But no, it's a flat piece of ground now, and we're now preparing the ground ready for the construction works to start in the next few weeks. And we're currently 2 weeks ahead of plan, so 2 weeks ahead of the contract schedule. So that's all good, and on budget also. Early days, but all good news. So the construction contract runs from the building part of the contract. We've been through the demolition. The building part of the contract runs predominantly from January 2023 next year through to October 2024, and we are planning then we've got a 2-week period of commissioning at the end of that, and then we're planning to open the new facility and indeed close the existing facility on the same day in the middle of November 2024, just ahead of the winter period for 2024-25. So that's always been our plan. Really pleased we've been able to keep the timetable for that. Just before I pause, just to say there's a few things that have had to temporarily be relocated across the site as part of the works to enable the construction part of the works. So we've moved the discharge lounge from what was itself a modular building in the next to the staff car park, currently next to the building environment. So that's now on our blue ward on sea level in the main building. And that's work that's been running there now since the end of August, and it's working really well for us. So that's fine. We also members will know we had what's called a relocatable CT scanner, effectively a CT scanner in a what looks like it's in the back of a truck, but it's a relocatable CT scanner in that area as well. That's moved to the north entrance, next to the north entrance. Unfortunately, that's had to temporarily displace some disabled car parking spaces, so we're currently looking at relocating those across the site. And of course, we've got the challenge of the site being on the side of a hill, so we've got those issues. But yeah, in terms of the emergency department, really pleased. I'm sure everyone's seen the visuals, the fly-throughs and the designs and everything that supported the planning permission. Really excited to have this finally now become a reality. And so, we're less than 2 years away now from opening that new facility. And probably the final thing to say is, if you just stand by the side of this site to see the scale of it, it's ginormous. The existing ED department, our current ED department that we're operating out of, which is a very constrained environment, that's very aged environment, is currently 3,000 square meters. The new ED department is almost double in size. It's over 5,500 square meters. So it's big in terms of its environment, but it also gives us a floor above the main clinical footprint, which allows us to have staff, staff areas around sort of well-being, changing rooms, rest break areas, and so on and so forth, which is just something that the current environment doesn't allow us to do. So hopefully that'll be good for staff well-being, for recruitment, retention, and actually for the well-being of our staff as well, given that it's a very challenging environment to work within. So that's all I was going to say, but listen, happy to take questions, and I can see Councillor Agate's already got his hand up.
Thank you. Yes, Councillor Agate.
Thank you, Chairman. I noticed you're using ANPR on the new North car park, will you be introducing that in the multi-story?
So we are, yes. So we're going through a phase at the moment where we're introducing automated number plate recognition software across all of our on-site car parks at Queen Alexandra Hospital, staff car parks and public car parks. So we're just rolling that out at the moment.
Good. That should save me a few bob with my wife, taking my wife down there. Thank you.
Thank you. Any other questions? If you've been awarded £58.3 million, is that you happy that that's going to be enough given the sort of current financial situation? Are you concerned that the rising prices are going to have any impact on that?
Oh, really good question. Thank you. So we've got £58.3 million nationally. You may be aware from previous reports to this group that the scheme is actually costing us 64.9 million, so to just under 65 million. And the difference between those two numbers, the trust is funding itself through its own discretionary capital, which is supported by the Hampshire and Isle of Wight Integrated Care Board. We've already spent, believe it or not, we've already spent over £5 million to get to this point through all the various planning and design stages and everything else, and now the demolition works. And obviously we will continue to spend. But we've got, so the total scheme is almost 65 million, supported nationally by 58, with the difference funded from the trust locally. So then back to your question around the optimism around inflation. So we have got contingencies and so on built into the contract. This is the biggest question that Treasury tested us on before they give us the 58 million. And the single biggest reason why we've got confidence is that we've got a fixed price contract with the provider. It's a guaranteed maximum price contract. So that gives us a guaranteed maximum price. We've got contingency outside of that. Now, what everyone on this call will probably know is a guaranteed maximum price contract sounds brilliant, doesn't it? But it's only as good as the design that we've signed off. So if anyone starts tweaking and changing the design, then the price changes. That gives the contractor opportunity to change its price and then rebase based on inflation. So my job and the job of the trust at the moment is to make sure that if we've got any changes that we decide to make to the design in the next couple of years, that we save them until we're in the live environment, and then that will save us cost. But yeah, so we're fully intending on delivering it to cost within the envelope. And obviously the contractor, in giving us a guaranteed maximum price, has built in a forecast of current inflation over the next 2 years as well. So hopefully that goes some way to answer the question.
Thank you. Councillor Richardson, you had a question.
Yes, thank you, Chairman. I just wanted to talk to you about recruitment. Obviously, we've just been talking about how difficult it is to recruit, and I know we're 2 years off, basically, before the project is completed. Are we starting to look at recruitment? Are we doing anything? Obviously, the capacity is greater in this building.
Yeah, so believe it or not, so yes, we are recruiting, but let me just qualify that in a few ways. So first of all, believe it or not, this might sound strange given I've just said that our current ED facility is 3,000 square metres and we're moving to somewhere that's almost double in size. Believe it or not, the workforce plan for the new emergency department is not dissimilar to the existing workforce plan in numbers. Now that might sound strange. The reason for that is because we've actually currently, again, believe it or not, we've currently got for the ratio of staff to the square metres is actually significantly greater than you'd normally have for a 3,000 square metre unit. It's actually closer to what you'd have for a 5,000 square metre unit. And the reason for that is because we're currently operating in a constrained environment that's got lots of pockets in there, as you'll probably know, that's not therefore easily visible for our nursing and our clinical team. So you have to overstaff it to get the visibility, to get safety. So in theory and in planning, we move to the new environment. It's much more visible. I don't know if you've seen the fly-throughs, but it's much more visible, and therefore you can, the same amount of staff broadly can manage the new environment. Now, I think we all recognise that, once we move into the new environment, we'll have to reassess that again. Alongside that, what I would say is we are absolutely using the new emergency department to help with our recruitment and retention. And we've been very fortunate even in recent months, particularly since we've got this approved and it's now real, we've been able to recruit a large number actually of additional senior nurses and consultant into the department. attracted from other organisations nearby, actually, because of the excitement of being part of the journey for a new emergency department. So, and obviously that will continue as part of our recruitment campaign also.
I'm not surprised. Thank you very much. Thank you.
Thank you.
Thank you. Councillor Atkins.
Yeah, thank you. I appreciate you may not be the person who has direct knowledge of this, but obviously ambulance waiting times have been much in the news recently, and that's obviously related to A&Es. Are things working reasonably well at QA at the moment, or is that a big issue there at the moment? And will the new A&E help to manage that, or are other plans having to be put in place for the future to manage the issue of ambulance, sort of having to wait at hospitals a long time to offload patients at the moment?
Yeah, so I'll have a go at that and speak from some experience, given that I was on call last night and over the weekend and interrupted several times during the night, sadly. So we are an organisation, and we are an emergency department that's under challenge in terms of our operational pressures, exactly as you said, and we are an emergency department that unfortunately we're often holding ambulances longer than we should be outside our emergency department, and that's partly because of the constraints that we've already sort of mentioned, but also because of the demand. So one of the things that concerned me earlier on in hearing Joe's report around the local practice closing is we also know that, and don't take my word for it, you can, this is BBC reports and all sorts of national reports around this. We are an under-doctored area locally in Portsmouth as well, relative to the rest of the country. So we have got challenges. Yes, our new emergency department will help us with those challenges because, well, first of all, it allows us to put everything you'd expect in a modern emergency department in one place. So it's got all the diagnostics in the same environment. It's got paediatrics in the same environment. It's a self-contained emergency village, if you like, all in one place. So that will help us with flow through the department. And obviously we've designed the department to help create that flow through the department so we don't get bottlenecks. But that's 2 years away. And obviously we need to get through this winter and the next winter beyond and the time in between. So we've also got a significant programme of work called our Building Better Emergency Care Programme, which is our improvement programme to continuously help flow through the department and to minimise the number of ambulance handovers. And that's everything from accessing the front door through the emergency department, whether on an ambulance or walk-in, but also all the way through to discharges at the other side of the hospital, which allows us to create capacity to allow patients that need to be admitted from the emergency department to be admitted to the hospital without delay. So we've got a number of things happening around there. In terms of our performance, if you like, around the number of ambulances we've been holding, I could show you a graph that would show that we have significantly reduced our ambulance holds over a period of time, but that's not to say we don't get pressures. And I would have to say that right now, literally right now, and over the weekend, particularly with Strep A pressures and the pressures from a paediatric perspective, right now we are under a massive amount of pressure, and I'm not therefore surprised to see Tracy Redmond's given her apologies for the previous item. Tracy was one of the people that I was on the phone to in the early hours of the morning, trying to manage our local demand. So we are under pressure. The new emergency department will help, but we can't wait for that. We have to make some improvements now also.
And just a final point from the council perspective, is everything working as smoothly as it can be at the other end? So the council assisting in discharging, is there anything further the council and the ambulance services could be doing from our end to facilitate and assist you, or is it working about as well as it can be?
Thank you, and I really welcome that question. Thank you. What I would say is, from a Portsmouth City perspective, we're actually working just about as well as I think we could. I mean, there's always more we can do, isn't there? I think our challenge always here at Portsmouth, and Joe would recognise this. I know Joe's still on the call. Our challenge always here at Portsmouth is predominantly 2/3 of our catchment. But Portsmouth City is only 1/3 of our catchment area, so 2/3 of our catchment area is Hampshire, and I think it's fair to say that Hampshire's got greater challenges than Portsmouth there. So if I was on the Portsmouth equivalent of this committee, I'd probably be seeking some support in a larger way. But no, I think Portsmouth City is working reasonably well. I do think, though, however, as just going back to what I said earlier on, our so outside of social care, so in terms of primary care, community care integration across the city, I think it's probably more complicated than it needs to be. We know that we've got to again experience the weekend. We've got 3 primary care alliances operating across our catchment area. The one for Portsmouth, but we operate for a large catchment area, and obviously with different operating times and so on. And I think it's fair to say that our 111 system, as well as our 999 system, are currently feeling quite overwhelmed. So there's always more we can do.
Thank you. Councillor Agate.
Having a problem getting rid of the mute. Yes. Any idea of percentage-wise how much moving into the new premises is going to reduce your wait time in the emergency department? This is I unhappily had to spend a very short time in your emergency department earlier this year, and was whisked off fairly quickly, but it looks like daggers from the people who've been sitting there for a while. So I get the feeling that they weren't happy with me being washed off, but nevertheless they're sitting there and their wait time seems considerable. How is that going to reduce when you get it? What percentage? What can we turn around to people and say, this is what's going to happen when the emergency department opens up? This will reduce your wait times by how much?
And I understand the question, and I do, but I'm afraid I'm going to struggle to give you a sort of percentage answer on that. I'm afraid. I mean, but in all sincerity, what we are doing is we've planned the new design and the new department in order that we can meet the national waiting times for emergency services, whether it's ambulance handovers within 15 minutes, or patients waiting. 95% of patients wait within 4 hours, maximum 4 hours. So that's what we're planning the department for. That's what we've got a design signed off by the Treasury for, and there's been a lot of people who've tested that clinical model along the way. That's clearly not where we are now today. So there's clearly we're clearly expecting an improvement. Yeah, I probably struggle to define that in a percentage improvement, Councillor Agate, I'm afraid.
You must have some idea of how much it's going to improve by, surely. I mean, you're not going to employ any more staff, so you've got the same staff, a bigger area, just as many people coming in and waiting. How efficient is this new building going to reduce your wait time?
So you're right, mate. So I haven't got this in my head, unfortunately, to give you now. But there will be there's different. There's a mathematical difference. You're right, between where we are today in terms of performance and where the national standards are, which is where we expect to be when we move into the new department. So that's kind of the percentage you're looking for, isn't it? I just haven't got that in my head, I'm afraid.
Okay, but thank you anyway.
No, thank you, and thanks everyone for the support. And for making this happen, because actually it's because of the local support from this group, from the city generally, from our community indeed, that we've been able to get this scheme approved by Treasury at a time when, as we know, not all NHS building projects are being approved at the moment. So this is a success for the city.
East Hampshire District Council are only too happy to give you as much support as they can.
Thanks for taking the time to brief us, Mark.
No, thank you for your time. Thank you.
Thank you. Right. Item 6 on the agenda is adult social care, and Andy Biddle. I think Andy's around, so there he is. If you could give us a brief update on your report, and then I'm sure everyone's got a few questions.
Thank you, Chair. Good afternoon, members. So the purpose of the report is to update the panel on the key issues for adult social care period from June of this year to November of this year. So what we've done is included an overview of the work of the service, including the national legislation and guidance that's changed in that period. We've seen quite a few changes, as I'm sure you reflect. We've also included the government's proposed national reforms to the Mental Capacity Act and mental health legislation, quite significant pieces of legislation that we work to that have an impact on a lot of people within our community. The report also highlights the developments and challenges in the work of our adult care and support service, who work mainly with people with age-related needs and those with physical disabilities. and our intention to change our practice model to focus on something called strength-based practice in the calendar year of 2023. We've put in some developments in the work related to hospital discharge, and Mark was just referring to that work that we do in Portsmouth there. It's worth noting for Portsmouth, the relationship of integration with the NHS is a long established one. And so we work in a single team in terms of trying to help our residents come out of the hospital as quickly as is safely possible and get them to another destination so that we're freeing hospital beds as quickly as we can. There are inevitably going to be pressures. There are huge pressures. The NHS is facing a very tough winter this year, and for the reasons that you've just rehearsed, really, those discussions you've had with Joe and Mark. But the model in Portsmouth is very much nurses, social workers sitting next to each other and trying to avoid that sort of refer-on table tennis that you sometimes get, which hopefully produces a better model for our residents. The report also focuses on some developments in working with our residents who have a learning disability and the continued focus that we have on supported living as opposed to residential care for those people with learning disability. We've been doing work for a lot of years in Portsmouth to ensure people have got their own front door and as much independence as possible with the support they need clustered around them on that site. And the report details, really pleased in this calendar year to have opened Pated Court in Paulsgrove, which provided accommodation for a number of residents with learning disabilities, either in individual self-contained flats or in shared accommodation. It was on the site of the old Longdean Lodge for those of you with long memories, so a really good use of that site for our residents. We've also talked about our work with informal carers, our army of informal carers in Portsmouth, and that's shared nationally, obviously. I mean, when we talk about the health service and social care and the massive numbers that we talk about in contributions to the economy and employment, etc., it's completely dwarfed by the number of people that care without being paid. And so we really do owe a duty and support to our carers population. And we've also focused on some of our preventative work with our independence and wellbeing team. Where we can, we want people to be much healthier and in control of their lives. And that often depends on giving them access to services that they can draw upon that help them remain independent and have a lesser draw on either health or care services. And we share that aspiration with our NHS colleagues. The report's got some challenges in there around our management information and data. We're due to be inspected next year, by the Care Quality Commission for our delivery of statutory duties. And so data and management information is something we need to do a lot of work on in the next 12 months or so. And we've also included some issues around some items around our demand pressure that we're facing. We know that coming out of the COVID pandemic, we see people for a lot of reasons with higher acuity, higher needs, and we see a lot more demand coming into our service. And so we put some information there about that. We've also talked about our annual complaints report and then finally concluded with a summary of our governance activity and some of the risks that we see to the service over the next 12 months or so. So that's a summary of the report. As always, happy to take any questions.
Thank you, Andy. Councillor Agates, you've got your hand up.
Thank you, Chairman. Looking at page 34, the second paragraph there, similar services operated across healthcare and Health and Care Portsmouth Partnership proposal to decommission CIS and consolidate a more streamlined offer in early spring. How's that progressing?
So we're at the early stages of that, really. What we want to do is bring two services together so that we provide reablement and rehabilitation for more of our residents. That can be anything from support with physiotherapy or independent living equipment to rehabilitation programs that are written out by a specialist and then individuals are supported through carers. At the moment, we have a community independent service that operates on an office hours basis 5 days a week, but our Portsmouth Rehab and Rehabilitation Service operates 7 days a week. And so that gives us more scope. If we can put more resource into that service by consolidating the two services, then we can help more people essentially. We see a big demand on that service for people that are being discharged from hospital. As we know, a stay in hospital for some people can be really difficult. It can really impact on their abilities. So we need to try and help them get back to some form of independent living. But we also want to make sure that we're not overlooking those people that live in the community that aren't going to go through the hospital route, but equally have some kind of crisis or some kind of incident and then need support afterwards. So what we hope to do, we've started the review now. We're including our staff who work in that service and people who have used that service, so people with lived experience. And we'd hope to have a relaunch a service probably around about April time. That's why we've said spring of next year. So we're starting on that work.
Oh, thank you. Doubtless, the Portsmouth City Councillors are right behind you and supporting you all the way with this. We can look forward to a report from you at the next meeting of HOSP, I suppose.
You can indeed.
We shall look forward to it. Thank you.
Thank you. Is any other questions? No? Thanks for your time, Andy.
Thank you, Chair.
Thank you. Next item on the agenda, Southern Health NHS Foundation Trust, and I think we've got Paula Hull and Nikki Creighton-Young. Do you want to give us a brief update? Thank you.
Yes, thank you. Hello, I'm Paula Hull. I'm the Director of Nursing and Allied Health Professions at Southern Health. And just to sort of explain a little bit about what my role is, that means that I'm the senior nurse in the trust that sits on the board. So my portfolio is very much around quality and safety. And Nikki is the Director of Operations for our Portsmouth and South East division. So we're doing a bit of a double act for you today. I won't go through the report in detail, but it was really interesting to listen to the conversations that were happening prior to us joining, because I think one of the key things in our report is about the project that's called Fusion. And it's very much a piece of work that a review was conducted by Carnell Farah some time ago, which really looked at what's the right model of services provision in Hampshire and the Isle of Wight. And what it found was that there was a lot of fragmentation. And I think you've heard about some of that today in terms of primary care and Portsmouth hospitals, and where sometimes when you've got lots of different organisations, what can happen is you can end up with lots of boundaries and barriers and different ways of working that make it quite difficult for the communities within those areas to access their services really easily. So this piece of work is very much about bringing together some organisations so that there's some integration and that people get continuity and don't get a postcode lottery in terms of the sort of service that they're going to get, and that we can remove some of the barriers that are currently that we know are in the way of accessing our services. That project includes Solent NHS Trust, Southern Health NHS Trust. It includes about 500 staff that are in our children and adolescent mental health services in Sussex. And it also includes all of the services in all of the community and mental health services in the Isle of Wight. So very much using a model of seeking out the best practice, seeking out what works and trying to replicate it. Very much trying to remove duplication where we're already doing things over and over again in lots of different situations. And some of you may have experienced lots of organisations walking up your path to visit you and having to tell your story many times, and maybe us not having the coordination that you would hope we have around that care that we're providing for you. So this is very much about looking at that. We have a range of community focused and hospital staff working on this across all those organisations. So it's very much being led by people who are working on the ground in these services. And hopefully you will have been involved in some of the stakeholder work that's been conducted. There's been a letter that came out in October, and about 70 people at an event on the 22nd of November and another event on the 25th. But we certainly haven't gone far enough in terms of engaging people. We really do need to go an awful lot further to make sure that the people in the communities we serve are there with us to shape these services going into the future. We're hoping that we're going to have a detailed business case to go to all the boards of each of those organisations by March 2023. And the final date for the new organisation to be formally acknowledged is April 2024. So really, really keen to get as many community, voluntary sector and other organisations and communities involved in helping us to shape what we're really expecting is going to improve the outcomes and the experiences of people across the whole of the patch, but particularly in Portsmouth and South East patch as well. And just to add to that, an example of how we're already starting to do that, and I'm sure Nikki can give more detail as well on this, but we're working really closely with primary care. I think we've got good examples of that in your patch in Portsmouth with the Willow Group, but we've also just conducted a partnership piece of work with Solent Hampshire Hospitals Trust and the local North Hampshire Urgent Care organisation to support another practice, unfortunately, in the Basingstoke area that has just also handed back its contract. So we're really trying to work in ways that are collaborative, in partnerships, because some of these things are quite big risks for small organisations to take on. So what we're trying to do is engage with a number of organisations who can share the risk, but also bring some different perspectives perhaps, and a really integrated view of how we can support communities both with their acute needs and their longer term needs. So happy to take any questions. I don't know if Nikki's got anything to add, but we're both here to pick up any questions you may have. Thank you.
Thank you. Councillor Agates.
Honestly, Chairman, I'm not really hogging it. Just a few questions. I see you've got an increase of over 100% on your referrals from SCIS. How are you coping? That's page 54, about halfway down.
Yeah, happy to come in on this, Councillor Agate. I mean, you know, it's challenging. We've obviously had significant focus that we've been doing on the National Frailty Programme for us across the Portsmouth South East Hants system, and part of that is our response around urgent community response. So it is the same nursing teams and therapies that are going out there and supporting this urgent community response. And it is challenging in terms of the activity and the increase. However, what's really positive to see is that those pipelines are working. And I know if Tracy had been here from SCAS today, she would have been able to show some of the data that actually shows the numbers of admissions that have been avoided to the acute hospital as a consequence of all the work that is going on across community teams in managing that admission avoidance work, trying to keep and support families in terms of caring for them close to home and support them at home. So it's absolutely the right thing to do. We've developing the workforce continually in this area of work, so developing roles in terms of emergency nurse practitioners, assistant clinical practitioners that may not have previously been in our portfolio of workforce across community nursing teams to the same extent. And it is making a real difference. Just recently, we started to do some work with the fire brigade as well in terms of the support that they can offer, working alongside our community teams to support the falls and frail patients in terms of health and wellbeing checks, and also being able to go out with our community nursing team, which then allows one of our nursing staff to go out with one of the officers from the fire brigade, as opposed to sending two nurses out when somebody's had a fall, etc. So it's really how we can drive that efficiency by, as exactly what Paul has said, working across organisations, being really collaborative in our approach. And we are seeing significant improvements in terms of that activity, and we'll continue to see that over the coming year. I think, you know, part of the challenge for us and our ask for your support alongside Hampshire as a local authority as well, is that continued investment into community services to support that urgent community pathway, because it does make a difference, and it's right for patients to be able to care for them at home and avoid those hospital admissions. And if they are going to hospital as part of that frailty work, ensuring that we're getting them home at the earliest opportunity. And we've all heard the, really challenging situations in the acutes of particularly frail elderly being sat in ED departments for, unreasonable hours. And this is all part of the work that we want to do to address that.
Lovely, thank you. That's so even though you've had the over 100% increase in calls, the other sources you're able to call on have enabled you to manage that very easily. By the sound of it, you're doing well.
Yeah, I wouldn't say it's easily, Councillor Egay. I wouldn't want to say that we're meeting all of those patient needs either in that regard. But what we're able to see now in that collaborative working with South Central Ambulance Service ourselves, the acute hospitals, is where we can improve those pathways even further, and where we can, drive some of that efficiency that enables us to continue to prioritise the right patients at the right time.
I noticed your bed management's doing well. You saw an increase of 29% on discharge.
Yeah, we've done a huge amount of work across our community inpatient teams. With that, you may have seen it, our Home for Lunch campaign. That's part of the work that we've done, working in partnership in the Portsmouth South East Hants system with Portsmouth and Solent colleagues as well, to be really focused on trying to get people out of hospital when they need to go into our community rehab beds as early as possible in the day, therefore allowing that increase of flow of discharge. And some of that quality improvement work that we're seeing through that Home for Lunch campaign is really, paying dividends in terms of that increased flow of discharge into those beds, which is a really good news story for everybody to be able to see. Absolutely. Recognising as well that we have got an additional 6 surge beds open at the moment, so 88 beds in the southern space as opposed to our baseline of 82.
Excellent. Now one last little item. Page 51, the community engagement meeting took place on the 25th of November. Should somebody from South East Hampshire, East Hants District Council, have attended that?
I'm sure we absolutely want to be engaged with you, definitely. And I'm not sure of the exact membership, Councillor Agate, so I can't tell you if you were there, but what I do know is that we're absolutely keen to make sure that we know the connections that you have out into your communities, and we really would like to work with you on that. So I can make sure, following this with our communications team, that we've sent you all the relevant information and that we have got those connections with you for each of those meetings.
I'd appreciate that. It makes some of the stuff that turns up here more identifiable, more you can understand it better. But thank you very much.
Thank you. Councillor Richardson.
Thank you, Chair. Could I also just ask that you send me that information, because I'm fairly new at this and new councillor, so I don't think I'm receiving all the information, so I'm not attending some of these meetings. I just wanted to ask you about some community health issues. I don't know whether it's drug and alcohol abuse or mental health. So, but we've been having quite a few problems here on Hayling Island, and my mailbox is pretty full of all of this stuff, and it seems quite difficult to manage these. Certainly, the people that are causing the issues clearly have issues. I don't know whether or not they're being helped. I mean, obviously, they have capacity and can manage things themselves. But constantly the police are being involved in these issues, and it doesn't seem the most appropriate thing. They're sort of acting quasi community health workers, which is a real shame. So I just wondered if you can advise how best to manage that, who would be the most appropriate people to call in order to help the people that are contacting me, but more particularly the people that have the issues that are causing the problems.
Thank you. I'm not sure if Nikki and I will probably do a bit of a double act on this. So the Drug and Alcohol Service is actually run through Solent NHS Trust, but we actually have a lot of partnership arrangements where we work very closely with them, because as you can imagine, a number of people that are on our caseload actually do require the support of that service. So we do have regular meetings with them and communications with them, and that does include the police. So there are definitely forums set up to receive some of that information. I haven't particularly heard that Hayling Island has got a particular issue, but we can certainly escalate that through to that group. And it's one of the things that I think with the new fusion work, where we're working closer together, I would hope that we would start to see some even closer arrangements around how we manage people that have got drug and alcohol issues in our services in totality. And I know Nikki's really involved in that work, so I'm sure we can make sure that your feedback is plugged into the work stream work. So thank you for that.
I don't particularly know what these individuals' problems are. I'm just sort of using broad terms there so that it covers the issues that I've been confronted with.
Yeah, and you know, this time of year can often bring, I'm afraid, it's a difficult time for some people, particularly if they're estranged from their families. It can create a sort of increase in people's needs and anxieties. So we can definitely raise that. Sorry, Nikki.
No, it's okay. Thank you. I was just going to add to that, Councillor Richardson, in terms of some of the work that we're doing across our community mental health teams, working really closely with primary care as well, and having mental health support within our primary care, because we know that's quite often a first part of call for families when they're having particular difficulties in terms of mental health. I guess what would be helpful, if you are able to find any more information out or you want to connect offline around that, is just to have an understanding whether they're actually referred and part of a mental health patient caseload, or if it is sort of more broader and does need to link back with primary care and other voluntary sectors as well. But I'm happy to follow that up offline with you if that's helpful.
Thank you, Nick. Have you got my contact details?
I have,
you will have them from this.
Yeah.
Thank you very much indeed. Thank you.
Thank you. Are there any other questions? No. Thank you, Paula. Thank you, Nikki.
Thank you very much indeed.
Thank you. And the final item on the agenda today is from Health and Care Portsmouth and the Integrated Care Board. And I think we've got Joe York back again and Julie Mascary.
Hello. Yes, thank you, Chair. So as we usually provide you with a sort of a letter, as we have done, we've picked out this time some areas that you were particularly interested in and asked for more information on off the back of the previous meeting. And those three were elective care, urgent treatment centres, and the GP retention scheme. So Julie is here because she's been working on the elective hub, so can provide you with some more information around that, if that would be helpful, and to answer any questions. So are you happy for Julie to give you a bit more information about the elective hub?
Yes, please. Thank you.
Yep.
Thanks,
Thank
Joe.
you,
Hello, everyone. So I'm Julie Mascary. I'm the Strategic Projects Director. I work for Hampshire Hospitals, but for this project, it's a collaborative project across the whole of Hampshire and Isle of Wight. So the 4 acute trusts are coming together to put their support behind developing a specific elective hub, and I'll explain a little bit more about that and what that involves. In response to the funding that became available to help us deal with the backlog that has come about because of COVID. So we've been allocated a notional sum of around about £33 million through the Transformation Fund to develop what is becoming a real centrepiece for elective care, which is a dedicated centre which will provide 4 theatres and 44 beds, a combination of inpatient beds and day case beds. And the reason for creating a standalone hub, it is going to be based on the Winchester Hospital site. So there's some benefits of being adjacent to the site, is that it's completely ring fenced. So what generally happens, and it's happened an awful lot through COVID and because of the pressures around non-elective, is often non-urgent elective cases get stood down and cancelled because the beds need to be handed over to the emergency patients, and so that's causing a real problem in our system. So the project is, as I say, to develop a standalone unit on the Winchester site that will provide services for 3 specialties, and that's orthopaedics, and it's the hip and knee replacement specifically in orthopaedics, and there'll be 2 theatres dedicated to that. The other specialties are urology, and then the third one is ENT, because those are the 3 specialties that are facing the biggest challenge across our acute sites at the moment. There will be, the way the pathway will work is there's choice for patients. So patients will be referred in those 3 specialties into their home trust. So Portsmouth, Southampton, Isle of Wight and Hampshire hospitals. That's either Basingstoke or Winchester. And if they meet the criteria that we've set for the hub, they will be given the choice as to whether they want to go and have their procedure in the hub facility. So it's not that patients won't have a choice. So they don't have to go to Winchester for their operation. They could stay and choose to remain in Portsmouth, Southampton, Isle of Wight or Hampshire or Winchester or Basingstoke. So there will be choice. The consultants then, if the patients choose to be treated in the hub, will then take their patients. So they will be operating on their own patients. So it won't be that they're transferred to somebody they don't know. They will come and have some of their job sessions, their job plan sessions in the hub, and they'll list their patients for their lists in the hub and bring those patients up. The majority of the pre-assessment activity, because of the nature of the patients, will be done remotely or on the home site. So we won't be expecting patients. There will be a small percentage that will need to travel for pre-assessment up to the Winchester site, but the majority of patients, about 90%, will be seen and managed locally through their virtual pre-assessment clinics locally. Once patients are discharged, they will then be seen for any follow-up back at their home trust. So again, trying to keep as much of the care of the patients local to where they live across Hampshire. So I think the other thing that's key to say is this will be operating 6 days a week consistently, long days. So it will be a 10-hour day operating list. So we'll get through a much more activity numbers than we can on some of the home sites because of the way we're going to operate the facility. And we're looking at centres that have successfully opened similar to this across the country. So we've been to visit those sites to see exactly how they operate clinically and operationally, those units, to draw on the best practice so that we build that in from the start. What's been great about this, and I think it is a unique project, is that it's bringing together clinicians who are learning from each other and sharing best practice, and it's very clinically led. So the clinical model has been developed by the doctors, nurses and allied health professionals working in our system, and so it's great to see that collaboration of sharing good practice and working together, and there's lots of enthusiasm within the system. So we're one of 3 centres across the southeast that are being developed to create a hub. So we're really pleased that within Hampshire and Isle of Wight we've been allocated funding to do this. And just to finish off, the programme at the moment, as Mark mentioned earlier with the Portsmouth cases, we have to submit a detailed business case to the NHS central team. The aim is to have that detailed process completed by the end of 2023, with a view that we can commence building in early 24 with it's a 62-week build process, but will hopefully be open and operational mid 2025. So that's the rough timetable at the moment. Clearly, that's what we've sketched out at the moment. If we can bring that forward earlier, then clearly that's what we're endeavouring to do with our contractors, who we've appointed now and who are working through the design process. So I'll stop there. Oh, sorry, just one other thing is we have done some, we've worked with Healthwatch across Hampshire and Isle of Wight, and they've been really helpful in doing some initial consultation with patient groups, both those that are waiting on our waiting list currently. And whilst there have been some issues flagged that we're going to take account of during our design process, there is support for patients to travel to the Winchester hub. Some patients will need help with transport, so we're looking at our policy around transport to help them if they need transport into the hub. But we're factoring in some of the comments to make sure that we take account of the feedback, and we'll be doing further focus groups with patients in the new year. And that's it. Happy to take any questions.
Thank you. Councillor Agate.
Thank you, Chair. It's I know you will be working on a 10-hour operating day. And that's one hell of a 6-day week as well, isn't it?
Yeah, there'll be, yes, Councillor Gate, there will be a mixture of consultants working throughout the days and across the week. So it has been designed by the consultants, so they regularly do that now in the home trust as well. Less so on the Saturdays, so more Monday to Friday, but a 10-hour day is not unusual. Not all of the 10 hours will be in theatre. There'll be a pre and post ward round to prepare the patients, consent them, and obviously follow them up after the procedures. But it is quite a standard day for some of the theatres that are operating currently.
I mean, I fully appreciate what you're attempting, what's going to happen, ideally, because it's such a good location for the whole of Hampshire, and it should certainly smooth out the flow of work that needs to be done. So thank you.
Yeah, and I think one of the key things across Hampshire and the Isle of Wight in planned care is the fact that we're trying to make sure that all patients, wherever they live, have equal access, and that there's parity of access for elective services, and that's a key objective for the Planned Care Board in the ICB at the moment. So that's very much at the top of our agenda, which is important.
Can I have just one more quick question for Joe York?
Joe, did you have any more to present, or?
Well, yeah, it's just a quick question about dentistry, national health dentistry. That's how is that going? Is it dragging its feet? Are you getting anywhere with NHS dentists in Portsmouth?
So we do have a little bit of good news on that front. We have so one of the things that's happened is 4 procurements additional dental procurements have taken place, 2 of which are in Portsmouth. So we should see 2 new practices opening up from April 2023, which will have quite a significant impact and improve the position. It still means we're hugely challenged, and I think even with that we will see less of our population accessing NHS dentists, slightly less, an improved position than the national average. So there's still more work we need to do on dentistry, but this will help quite significantly. We're also doing some work with Dr. Helen Atkinson around oral health strategy, and working closely with the university, so Portsmouth University, around a new national initiative around a centre for dental development, and so looking at whether that can support any additional work as well. So again, in NHS dentistry we have lots of workforce challenges, so we're continuing to petition hard around could the University of Portsmouth Dental Academy become a full dental school? Is there more we can do to support international recruitment and make it easier for international dentists to work in the NHS? Because there are more restrictions to them being able to work in the NHS than there are working privately in the UK. So we're looking at all of those things, as well as trying to build relationships with local dental practices and work with Health Watch as well. So I can certainly give the committee a more detailed update on dental provision at the next meeting, if that would be helpful.
Look
Yeah, I
forward
think
to
that
it.
would. Yeah.
Thank you.
And happy to take any questions if there are any on the UTCs or the GP retention scheme.
Any other questions for anyone? No? No, I think that's it. Oh, sorry. Julie, you got a question?
Thank you, Chair. Yes, I just a very quick question on the nurses' strike and the possible ambulance strikes. I just wondered, how you are managing that, and whether or not you're having to cancel any appointments because of them.
No, so obviously if Mark were here, I think Mark, which may still be here, but I hope I will get this right. But my understanding is that QA isn't one of the strike sites. So there's nationally they've allocated, and QA isn't one of those for the nursing strikes. So yeah, that is right. Nothing's changed. So that's really positive for us locally, because it means we won't be affected, and given the pressures we've got, that would be quite a challenge for us. We've been working closely with SCAS and monitoring the paramedic strike, and again we're not anticipating we'll be overly affected in this area at this point, but we recognise that those conversations are still ongoing, and not all the unions have made the decisions yet, I don't think.
Thank you.
Thank you. Joe, did you have any more to report? Or?
Not really. As I say, this report was sort of more specific because it was a bit of an interim report, and I was asked to come back sooner than I normally do. I suppose the only thing really to say on the UTC provision is that is also extremely challenged at the moment with the increase we've seen in the strep A demand, but we're working very closely with St Mary's to maintain their capacity over the next sort of month or so, because we have seen such a huge increase in demand in that service, and we will be working with them in the new year to get to look at, can we get back to the 10 p.m. opening time. They've had a number of senior staffing changes at the unit and changes to their internal senior management structure. So whereas we had a hospital director or a urgent treatment centre director across both the Southampton and Portsmouth site, they've now put those back into a hospital director, one for Portsmouth, one for Southampton, which I think will be a really positive step forward. So we're working with them to really look at how that can make a difference. Can we get it back opening up and to 10 o'clock in the new year?
Thank you. Councillor Jeffrey, did you have a...
Yeah, my question was just on the strikes. Was that just the current round of strikes, or the ones that might happen in the new year for the QA?
My understanding is it's the current round, but Mark might have more information on that.
No, it is for the current round of strikes, but there are 2 dates, aren't there, for the nursing strikes? So today and next week, and so for these 2 Royal College of Nursing strikes, the QA site is unaffected. We're still trying to work through what it means for us in terms of the ambulance staff strike that's obviously happening later in the month, so we haven't got as much clarity on that yet, Joe.
Okay, thanks, Mark.
Thank you. Any other questions for anyone? No, that's the end of the meeting then, I think. Thank you for taking time to come to the meeting, and happy Christmas, everyone. If you could just stay online until we get confirmation that Anna's turned off the live feed. Thank you.
I'll just turn it off now.
I can't believe we finished so early.
No.
Oh dear, we can have some more of these. Yep.